Hey, internet friends. My COVID haircut is now growing out. I haven't done a video series in a while, so I thought maybe it was time to do a Q&A, an FAQ, if you will, called Ask the Structural Chiropractor, with just a bunch of random questions where I give you my input on, common controversies within healthcare or, just stuff that patients ask. Maybe a little bit of boring stuff, maybe a little bit of exciting stuff. I want to start off with something random. My first question is this. Why does my radiology report say normal alignment while my chiropractor says there's a problem? If you read comments from sometimes well-meaning people, but also internet trolls on, what is my chiropractor doing? I went to the chiropractor and this happened and what's going on? You'll hear the story of someone will say, well, my primary care physician said this was normal. My radiologist read it and it said, this, that, and the other, and it was fine. And then the chiropractor said it looked terrible. What's going on with that, right? What's the difference between these two? Well, I can kind of explain it, not very shortly, but in a long kind of roundabout way. But first, what I want to point out is that I'm just a guy. I'm just a chiropractor in Auburn Hills, Michigan. I practice something called upper cervical chiropractic procedures. And I integrate that with a few other techniques to provide positive shift in the spine and frame of the body. I have other other videos that you could look at to kind of understand what that's about. So what we've done here is we've taken what's called a, quote, normal lateral cervical x-ray of a male age 12. And this was from a radiologist who uploaded it online. What are medical physicians looking for when they take an x-ray? They're primarily looking for pathology, which is a disease process, evidence of a disease process, perhaps like in the spine, like a bone softening disease, or maybe a tumor, or maybe something like a hemangioma, big collections of blood vessels where they shouldn't be. Or they're looking for breaks, they're looking for fractures. That's primarily what medical physicians are looking for when they order imaging, like an x-ray of the spine. Chiropractors are trained to scan for those things, to identify them, to say, hey, this may be a problem. This needs to be looked at first, but we're not taking them primarily to rule out a disease process or fracture. We're primarily taking them for what we call biomechanical assessment, or for those of us who practice with what we call a structural orientation. If you take a look at this x-ray, in front of you, zoom in on the base of the pinky, you're going to see two little, or rather large fractures for this bone. This guy was probably upset and started punching a wall or something. So this is, quote, not a normal x-ray of a hand because there's a fracture there. So to review, there's no pathology, that is no evident disease process in this 12-year-old. There's no fracture, so therefore to the radiologist who uploads this to the internet, it's normal. This is a normal x-ray. And so from the radiologist's perspective, from the medical physician's perspective, this is a normal x-ray. But from the structural chiropractic perspective, it is not. Well, the history on this is that this child had a fall from his bike, and he ended up with some neck pain. And that neck pain was, quote-unquote, midline, right here in the middle, maybe on the backside, who knows, it doesn't specify. But the child had a fall, serious enough trauma to take the child in, get an x-ray, and the x-ray turns out to be normal. Well, maybe, maybe not. From our perspective, the fact that the child had a trauma and is in pain, and there's some subtle alignment changes, this may mean that the child could use a chiropractic visit. So let's go ahead and take a look at that. So 3 things I noticed from a structural perspective. These are all 3 things that don't stand necessarily independently of each other, but we put them in the context of this individual's case, or the history. Number 1 is the position of the atlas vertebrae. So the atlas vertebrae, in an oversized version, is this guy right here. It is sitting at the base of the skull, between the base of the skull and the second cervical vertebrae. An overhead view of the atlas is up there on your right. That's another overhead view of the atlas there. So we're looking at it from the side in the x-ray, and there's a few things I want to point out about it. One is that the back of this x-ray, the back of the C1 and this posterior arch is very close to the occiput, very close to the back of the skull. Now, I've seen a lot of x-rays. There are some where they're like that, but they're oftentimes because there's a loss of the cervical curve, or there's been an obvious shift in the first cervical vertebrae. So this may be a normal presentation for this 12-year-old, but more likely than not, it's not. In other words, the normal or let's say, non-misaligned or malaligned position of this vertebrae would be to have this back end be sitting somewhere down in here. We have further evidence for that when we look at this space here. This is called the atlantal-dental interval. The atlantal-dental interval is looked at by radiologists and measured. If it's too big, that suggests that there may be some trauma at the top of the neck, a fracture. Well, it's not too big here, but it is kind of V-shaped, so when we follow this down, it looks like this. Okay, so that's suggesting that on the front end of this vertebrae, it's possible that this thing is kind of tucked up slightly like this, pulling up, relative to, it's hard to see, I don't know if you can see it in there, relative to that, what we call the dens in there. And it may be possible for that vertebrae just to shift subtly down like that, more oriented towards this way, as opposed to being as flat as it is here. That is one possibility. Second thing that I notice is that the top of the neck has lost the curve. So if we put a few dots on here, what you'll notice from the bottom of the 7th cervical vertebrae, this is the bottom of the neck. That's the bottom corner of that vertebrae. Here's the top corner. Here's the bottom corner of the 6th, the top of the 7th. Bottom corner of the 5th. And I'll come back just a little bit. And top of the 5th. Okay. And now we get into the 4. And 3, I got to move back a little bit. And then 2, here. Up to here. Okay, what we notice if our eyes follow those dots is there is a little bit of a curve, and I'll try to follow it, but I'm not very good at drawing, on the bottom. So between 5, 6, and 7, there's kind of a soft channel curve. And when we get to 4, 3, and 2, that trend changes. 4 is kind of part of it, but then 3 definitely looks like it's sitting slightly posterior or backward. C2 is just slightly forward of the 3. So it suggests there may be a posterior or rearward malposition of C3. It may just be locked slightly relative to the 4. This may be causing a loss of cervical curve at the top of the neck. Another evidence for that would be if our eyes follow the kind of the trajectory of C6, C7, C5, we're going to see kind of a lift on 5. There's going to be kind of a lift on 4. There's kind of a lift on 3. And then you get to 2, it's going to kind of drop down like this. So this is just another physical indicator of the loss of the cervical curve. In a 12-year-old without that loss of cervical curve, those lines are going to be more oriented kind of like bicycle spokes, moving away from each other as opposed to being parallel. 3, the subtle signs of vertebral rotation. So what do I mean? Well, when we look at an x-ray from the side, we look at a skull from the side, what we're seeing is we're seeing overlap of both the right or the left elements, so we're only seeing a flat version, right? Kind of like you're seeing here. This is a three-dimensional structure, but when I turn it this way, you're seeing flat. And in an x-ray, you're actually seeing the right and the left side superimposed on each other. When we look into the skull on this person, when we look at the ear area, when we look at the jaw, what we notice is that these structures are basically superimposed. So this is the auditory meatus. We're looking through the temporal bone. Here's something called the sella turcica. We're looking at where the pituitary sits. There's a slight rotation or malposition of the jaw, or rotational position of the jaw. When we get up here, the TMJ joint looks pretty well overlapped. So that's important because that tells us that more likely than not, this patient was set up for that x-ray, their head was centered to that x-ray film. That tells us then that when we look down the spine, that we may be seeing actually some rotation, because we're going to assume that this patient's sitting comfortably, and they're not intentionally like turning or rotating their body. They're just using their natural posture. The head we're looking at from the side, and now when we look down through these vertebrae, we're going to notice that we don't have the same overlap. In other words, we don't have the same phenomena of looking at the right and the left superimposed perfectly on each other. In fact, when we get down to C3, we can see the back joints overlapping like this. There's quite a distance from here to here. C2, also the case, quite a distance from here to here. Not as much as C3. C4, a little bit, not as much. All right, misnumbered. C4, down here. C5, not as much. We can also look at the back end of the vertebrae here and kind of see this ghost outline on 5 kind of see this ghost outline on 4. You can see that same kind of ghost outline on 3 as well. Possibly a little bit in 6. We don't actually see that on 7 though. We can only really see just one aspect of this vertebrae. We look back over here at these back joints and we don't see a superimposition. I'm sorry, we don't see an offset. Another way of looking at that would be looking at these models that I have here. So when a vertebra is perfectly centered and there's no rotation, then we're going to see the right and the left overlap like this, right? So it looks like a single vertebrae. When we have a little bit of rotation, then what we're going to see is we're going to see an offset, particularly on the back side of the joint. And so it's going to look like we almost have two vertebrae kind of sitting next to each other, when in fact it's a single vertebra. We're just looking at the right and the left, slightly offset. And so that is what's happening further on down, especially at the back joints at 2, 3, 4, 5. So we don't have an image of this patient from the front, but there's a possibility that if we did, we would actually see that rotation. So these are the things that I would see potentially in this patient that would require an investigation from me from a structural chiropractic perspective. The fact that it's a 12-year-old, he's fallen off his bike and now he has neck pain, that just adds to the story, right? That just adds to the story that this is deserving of an investigation. So from a medical standpoint, it's a normal, natural, neutral cervical x-ray. But from a structural chiropractic perspective, there's something that could be addressed. So that patient or that patient's parent may actually get two different stories there from two different practitioners. That's just because we're doing two different things and our focus is in two different areas. Medical physician is identifying a fracture or disease process. I'm looking at individual structural alignment of individual vertebrae and how they relate to each other to see how I might need to unlock them. Okay, this has been Dr. Zach Ward at Life Alignment Chiropractic here in Auburn Hills, Michigan. If you like this video, please click my other videos and watch them. Give me your feedback, leave a comment. Thanks for watching.